Doc, good evening to you.
Good evening, super fantastic, Brittany, and to the BNC staff.
And Doc, you heard what the doctor just said. Merck and Ridgeback Biotherapeutics say they now have a pill that will cut the risk of hospitalization or death from COVID-19 by half. If it's approved, it'll become the first oral medicine that will help fight the virus, assuming it's like Tylenol or something like that, I assume. What's your thoughts on taking a pill to help fight the virus?
Well, I mean, if it's a strong possibility, then we should bring it to the forefront as an effective treatment. But the reality is that, this is what they're saying again, it's experimental use authorization. So what does that mean? I would like to see the data. I think everybody should see the data and be informed on what the results are. Are the results based off of a clinical trial? Is it based off of a real presentation of the population? Are you giving this medication to children? Are you giving it to patients that have immunocompromised disease? Are you giving it to old folks and trying to get a good assessment of the effectiveness of the stuff? And once again, it's a potential game changer, but the data and the medicine and science is still out on that. And the reality is that we still have a long ways to go. And one of the things that's always difficult, very difficult to come up with treatment for ours. So if this is a Merck comes up with an effective treatment, a drug, I welcome it.
Yeah. And Doc, there are some countries now saying they are basically just going back to normal and just trying to live with COVID, basically. We talk about Denmark, Singapore, Thailand, South Africa. The country's leaders are saying they have high vaccination rates and some reporting lower cases. Is this good or bad that they're letting their guard down? What do you think?
The reality is it is bad letting the guard down, because what's going to happen is that you're going to create new super mutations. That is the reality. You can't have half the population vaccine, other half not vaccinated, and then this is what happens. You start interchanging that virus between the two populations. The virus gets an opportunity to live. The virus gets an opportunity to see what's in the vaccine, and this is how you create mutations. And the societies that do open up now because of the economic reason are going to be the societies that are going to shut down first. That is just the reality, because the virus is still not under control. We're still endemic infection. We have a long ways to go until we have an effective policy and procedure where everybody in the world, Brittany, is following that policy and procedure, from one, wearing antiviral masks, washing your hands, air purification units, understanding the public space, understanding testing, both antibodies and also testing individuals on a weekly basis. We're never going to get a hold of this virus, and we're going to continue to have mutations. And you see the numbers are going up now. We're right in the middle of September, October, November. Folks, we have a long ways to go, and the next 3 months is going to be critical for America and the world.
And talk about that, Doc, because you mentioned the next 3 months. This is the month that we have Halloween, Thanksgiving, the following month, Christmas, and next month, all of the holiday parties. As we were starting to see some drop in cases, we saw this last year that right after the holidays, the numbers spiked up. Do you think we'll see that again?
Oh, absolutely, Brittany. You've seen this in your own eyes over the year that we've done this. And the reality is that, folks, if we look at what the basic numbers that they're telling us, 2,000 people are dying a day. We know that number is probably wrong. It's probably 3,000 people are dying a day. You do 30 days times 3, that gives you the number 90,000 a month. You do that over 3 months, you're already up to almost 300,000 people. We will hit the 1.1 million mark by New Year's. That's a reality, unless we get this train off of the track and going into a different direction. And that is the reality, and not getting caught up in conspiracy theories, misinformation, disinformation. The science has to back the medicine, and the medicine has to understand the science for us to be able to move through this. We have to come up with vaccines that are effective. When I say vaccines that are effective, I mean we have vaccine for the alpha strain, the beta strain, gamma strain, etc. And we have to make sure people understand that this is going to be a long time work in progress as the science and medicine catches up. That is the reality.
And Doc, as you mentioned, we are inching closer to 1 million. The U.S. surpassed 700,000 COVID deaths on Friday, and our country still has the most COVID deaths than any other country. But the number of positive cases are dropping, but some states are still seeing an increase in hospitalizations. How are we seeing an increase and a decrease at the same time? How does that happen?
Depending on who's providing the numbers. We know that the state of Florida is very adamant about not giving information. Texas is that way too. And these are two of the biggest populous states in the union. So you can imagine if that number gets added to the tally, maybe we do not have a decrease in the positive rate. In fact, I would argue that the positive rate is going to be much higher than last year at this time, because now we got kids going back to school. We have football games are going on, sporting events, more people congregated together. And then what happens is that 6-foot rule of social distancing does not come into play. We have the potential to have super spreader events, and that is why we look at some schools in Florida, Texas, and North Carolina have shut down because they have COVID outbreaks in the individual schools.
Yeah. There's so much still unfolding with this. Dr. Lane Rolling, virologist and infectious disease expert. Thank you for your time. We'll see you next Sunday.